Hi, my name is Mary Bethel. I'm running for the State House seat for District 37, which is Southern Wake County. And I'm a first-time candidate, and I'm trying to get information out about my issues that are top priorities. And one of those is access to health care. When I was a senior in high school, my mom was diagnosed with cancer. And during the summer of between my senior year in high school and my freshman year of college, my job was to take her to cancer treatments multiple times a week, which were 180 miles round trip from our home. Also, my first job that I had when I was straight out of college was as a social worker. And I got to work with many people who did not have health care, or they had very, very poor health care insurance. And I saw many people go without care and the impact that it had on their lives. And that really made a lasting impression with me. That, along with the fact that I'd had the personal situation with my mother. I also worked with a lot of older adults during that time too that did not have access to prescription drugs. And you could see when they didn't get access to things like their insulin or high blood pressure medication, the impact this had on their health. Now, we're very lucky here in the Triangle area that we have some really world-class medical facilities and resources. However, if you don't have the ability to pay for your health care, you don't have insurance, it doesn't make one hill of beans that you need that care and that we've got all these good resources there, because you aren't going to get it. A lot of people go without care, or they delay in getting care until they're in a crisis situation, and they end up in an ER, which is the worst place in the world that you can go to try to get care for chronic conditions and things of that nature. So I think that we need to do more than what we're currently doing to try to improve access to care for folks. I also, the other day I was in the drugstore. I had two prescriptions for a newly diagnosed condition that I have, which is very treatable as long as I take my medicine. And I looked down at the billing information and saw that the total cost of those two drugs was $5,000. Now, I am really fortunate that I have good health insurance, and I had a very modest deductible to pay, or co-insurance to pay. But you've got people that don't have that insurance. And can you imagine if they had a bill like that and they had to even pay 1/10 of what that cost, what it would do to their monthly budgets? I guess it's not really surprising to know that the number one cause of personal bankruptcies in this country is medical debt, which impacts more people than we probably are aware of. So as I move forward in my effort to become your legislator, I want you to know that this is going to be a priority issue for mine. When I get to the General Assembly, I am going to work very hard to try and ensure access for all North Carolinians. Thank you, and I appreciate your vote.